The board fired the useless nurse. Minutes later, the Pentagon locked down the ER. Blood smells like copper and old pennies. But hospital politics smell like cheap lavender lotion and the slow rot of someone else's ambition. I learned to tell the difference a long time ago. Most people never have to. My name is Clara Reyes. On paper, I was a float nurse at Mercy General, which meant I was the person nobody planned for and nobody missed. The warm body that filled gaps, pushed carts, and disappeared into the linoleum when someone with a badge and a salary grade above mine walked into the room. They called me a lot of things. Useless was one of the kinder ones. Then the board fired me on a Tuesday morning in front of 37 people, and 40 minutes later, two US-60 Blackhawks landed in the hospital parking lot, and 4 Pentagon operators started screaming for a woman they called Spectre. Now let me tell you how we got there. Mercy General smelled like institutional bleach, and the specific sweet decay of something medical always going wrong. Diabetic ketoacidosis from Bay 2, stale sweat baked into the curtains of Bay 6, the cloying lavender hand sanitizer that Dr. Eleanor Marsh, the charge nurse, pumped onto her palms every 11 minutes like it was a nervous habit she'd never gotten around to unlearning. The fluorescent lights didn't buzz. They hummed, a low abrasive frequency that burrowed behind your eyes around hour 4 of a 12-hour shift and just stayed there. The floors were linoleum in a shade of off-white that someone had named Pearl Mist in a catalog somewhere, and that looked, under those lights, like the inside of a very tired mouth. I had been floating at Mercy General for 6 weeks. Before that, St. Ignatius. Before that, Valley Regional. I moved hospitals the way some people move apartments, not because anything went wrong exactly, but because staying too long in one place was a kind of exposure I wasn't interested in. The float registry suited me perfectly. No one took attendance, no one asked questions, no one expected you to be anything other than functional and available and gone by the end of your contract. To the civilian staff, the ER was a war zone. To me, it was a waiting room. I knew every exit in this building. I had cataloged them in the first 40 minutes of my first shift without deciding to. Second nature. The kind of thing your body does when it has been trained to do it, and you have stopped being able to tell the difference between training and instinct. There was the main entrance, 2 service bays on the east side, a fire door on the 4th floor that didn't lock properly, and a loading dock in the basement that would take your badge but not your photo ID, because the camera had been facing the wrong direction for 8 months and no one had fixed it. My hands were quiet. They were always quiet. I moved medication trays with the same economy I had once used to field dress wounds in conditions that made this hospital look like a resort, methodical, no wasted motion, no second guessing. Mrs. Patterson in Bay 3 complimented my IV placement every Tuesday. I had found her vein by feel, not sight, without turning on the overhead exam lamp. She thought it was a gift. It wasn't a gift. It was Helmand Province, 2017, where you learned to work by touch or you didn't bring anyone home. I was so tired. Not the kind of tired that sleep fixes. The other kind. Dr. Richard Calloway swept into the ER the way people do when they have decided the room belongs to them before they cross the threshold. Chief of Emergency Medicine, 3rd-generation physician, the kind of impeccably groomed that takes 45 minutes and means you never had to scramble for anything. He smelled like expensive cologne layered over surgical soap, and he walked with the particular authority of a man who had never once in his life been told to move. I was checking the supply chart at the east wall when he came in. He was speaking before he finished entering, already mid-sentence, voice carrying to every corner of the department because that was how he communicated, at a volume that made sure everyone understood the hierarchy before the content. Who cleared the trauma cabinet in Bay 4? He didn't look at anyone specifically. He didn't have to. The room arranged itself around his attention. I set my clipboard down. I restocked it, I said. The fentanyl count was off by 2 units. I filed an incident. I didn't ask you. He looked at me then. He had pale gray eyes that landed with the specific weight of someone who has decided, before looking, what they are going to see. Your float staff. Yes, float staff does not touch the controlled substance cabinet without authorization from charge nursing. He said it the way people say things they have repeated enough times that they no longer listen to themselves saying them. Who authorized you? The cabinet was unsecured when I arrived, and I don't care what you found. His voice carried. It always carried. 37 people in that department heard every word. You are a glorified inventory clerk. Your job is to push carts and stay out of the way of people who have actual qualifications. He looked at Dr. Marsh, who was standing 6 feet away with her hands folded and her eyes on the middle distance. Can someone make sure float staff understands the scope of their role here? I looked at the supply chart. A muscle in my forearm flexed once, and I overrode it. The count has been corrected, and the incident report is filed, I said. You can verify with pharmacy. He had already turned away. No one in that room said a word. I ate lunch in the supply corridor because the break room had too many people in it, and I needed 10 minutes where no one could see my face. I had a system. One of the storage rooms on the West Hall had a defective latch. And if you pressed the door at the right angle, it opened without a keycard. I had discovered this on day 2. I had told no one. I sat on an upturned equipment case and ate a sandwich that tasted like the plastic wrap it had come in, and I thought, not for the first time, about why I was here. I had left the Navy in 2019. Not because I was asked to leave. Because I went to Kandahar for the 3rd time, and something that I had been keeping very carefully together came apart in a way I hadn't expected and couldn't quite explain to anyone with the clearances to understand it. And when I got back stateside, I filed the paperwork and shook the hands and drove north until I found a town that didn't know my name. Nursing made sense. I already knew the medicine. I already knew how to function under pressure. I just needed somewhere to be useful at a volume low enough that no one would look at me too closely. I had a piece of shrapnel in my left knee from a vehicle ambush outside Sangin. It ached in cold weather and sometimes on stairs, and I had learned to walk in a way that minimized the tell. Mostly I succeeded. Sometimes someone noticed. I had 7 different explanations ready, and I rotated them, so no single person heard the same one twice. I wanted to stay small. That was the whole project. Stay small, stay useful, stay invisible. I was very good at it. I crumpled the plastic wrap and put it in my pocket and went back to work. The board meeting was at 11. I hadn't known there was a board meeting until I was summoned to it, which is the kind of summons that does not suggest a good outcome. Doctor, Calloway sat at the head of the conference table with the hospital administrator, a man named Gerald Pruitt, whose handshake felt like a damp cloth, and 3 members of the governance board I had never seen before. Doctor, Marsh was in the corner. She did not look at me when I walked in. Ms. Reyes, Pruitt had a voice designed for boardrooms and bad news. We've been reviewing the incident report you filed yesterday regarding the controlled substance cabinet. Yes, Doctor, Calloway has raised concerns about float staff overstepping authorized protocols. He glanced at a document in front of him. This is the third time in 6 weeks that you flagged a process concern outside your assigned scope. The count was wrong, I said. Someone had accessed the cabinet without signing. We are not disputing the finding, Pruitt said. We are disputing the pattern. Float registry staff are here to supplement our team, not to audit it. I looked at Dr. Calloway. He was looking at his phone. I had a choice right then. I could have said 7 words that would have ended this meeting in a way that would have made everyone in that room very uncomfortable for reasons they would never fully understand. I could have said my rank and my unit and the name of the program I had been attached to for 11 years, and I could have watched their faces do the specific thing faces do when they learn they have made a categorical error. I swallowed. It tasted like ash. I understand, I said. Effective immediately, Pruitt said. We are terminating your float registry contract. You'll receive your final payment within, I understand, I said again. I collected my badge from the lanyard and set it on the table. No one spoke. I walked out. There was a veteran in Bay 7. I had seen him when I came in that morning, 73 years old, Vietnam era, admitted with a hip fracture and a wound on his lower leg that someone had dressed incorrectly, and that was developing the specific smell of an infection that needed debridement, not another layer of gauze. He had looked at me when I passed, and I had looked back, and we had understood something about each other in the wordless way that sometimes happens, and I had flagged his chart for a consult that I was now no longer employed to follow up on. I thought about him in the elevator. I thought about what it meant that a man who had given everything he had was lying in a hospital bed with a worsening wound, while the people responsible for his care were busy firing the one person who had noticed. Something was already in motion. I could feel it in my teeth, and I didn't yet know why. I was in the main corridor, badge turned in, coat on, heading for the exit, when I felt it, not heard. Felt a vibration through the soles of my shoes first, then the fillings in my back molars, then the low harmonic pressure of main rotors at approach angle pushing down through 11 floors of concrete and steel before any window in the building had started to tremble. I stopped walking. I knew that sound. I knew it the way you know your own heartbeat, not because you think about it, but because your body has cataloged it below the level of conscious thought, filed it under the category of things that meant everything was about to change. 60. 2 of them, coming in heavy. Not the high frantic whine of a civilian medevac. A different weight class entirely. Rhythmic, deliberate, the sound of something that does not hurry because it does not need to. I pressed myself against the corridor wall. The civilian staff heard it 12 seconds after I did. The monitors kept chiming. Someone near the nurse's station looked up. Someone near Bay 4 stepped into the hallway. Then the windows began to vibrate in their frames, and a cart near the east door rattled, and someone said, very quietly, "What is that?" I knew what it was. I shoved my hands into my pockets and told myself, in the flat internal voice I used for hard orders, not here. Not my problem. You turned in your badge. You are done. The announcement came over the intercom, not a medical alert, but a security code I had never heard Mercy General use, because Mercy General had never had reason to. Code Gray. External event. All non-essential personnel secure in place. Through the corridor windows, 2 A-60 Black Hawks had set down in the main parking lot, not the helipad, which they had bypassed entirely. A third aircraft held pattern overhead. The rotors had not powered down. 8 figures came out of the first aircraft in tactical formation. Full kit, sidearms, body armor that communicated exactly what this was. They moved the way forces move, purposeful, establishing perimeter as they advanced. I heard Dr. Calloway's voice from the ER. Someone needs to tell me what is happening in my emergency department. A single voice cut him off. Not louder. Cleaner. We didn't come here for you. Whatever was in that aircraft required something this hospital did not know it had. I had known it the moment I heard the rotors. I had known it in the way my hands had stopped being still for the first time in 6 weeks. They were trembling, just slightly. I pressed my back against the wall and stayed there. Gerald Pruitt found me in the corridor 2 minutes later, flanked by 2 hospital security guards. He looked like a man whose Tuesday had become something he was not going to recover from quickly. Miss Reyes, I need you to wait in the administrative suite until we understand what's happening. I no longer work here, I said. Building security protocol, he said. Until we have clarity on the nature of this situation, all personnel, I turned in my badge. Miss Reyes, the security guard on his left, a big man named Dennis who had always been decent to me, stepped forward with genuine apology on his face. I'm sorry, we just need you to wait downstairs. They walked me to the basement. I sat in a chair in the supply room and I listened. The patient was critical. I could hear it in the pace of the voices 2 floors up, even muffled through concrete. Short commands, urgent, the specific cadence of people who are moving fast because the window is closing. I heard a monitor alarm that no one silenced quickly enough, and I heard Dr. Calloway's voice attempting authority and failing to find purchase in whatever was happening, and I heard, very faintly, someone saying a number, a blood pressure reading, that told me exactly how much time was left before it stopped mattering what anyone did. I sat very still for 11 seconds. Then I stood up. The vibration hit the basement floor first, a deeper register, the harmonic compression of additional rotors arriving. And then another sound beneath it, different pitch, different rhythm. I was already moving when I heard the stairwell door. The east corridor was chaos, staff pressed against walls, a gurney abandoned crosswise, someone's coffee broken on the floor. I moved through it without breaking stride. My knee ached. I did not accommodate it. Through the glass, the parking lot configuration had expanded. A 3rd aircraft had landed. A 4th was approaching. Coming through the main entrance in tactical formation were 4 additional operators, led by a man in his late 40s who wore no insignia I could see, but whose posture told me everything his uniform didn't. The automatic doors had jammed at half open. One of the operators drove the butt of his weapon through the right panel without breaking stride. Glass scattered. The team split, 2 flanking the lobby, 2 advancing to the ER desk. Dr. Calloway was waiting for them. I am the chief of emergency medicine, and I need someone to explain. The man in his late 40s looked at him once. Shut up, he said, not aggressive. Factual, he was already past Calloway before the word had landed. The team spread through the department. They were looking for someone, not responding to the patient, searching first. 2 speaking into earpieces. 1 holding a folder. The man stood in the center of the trauma bay. The civilian staff had arranged themselves against the walls. He scanned the room with the eyes of someone who doesn't move quickly, because they don't need to. I need Spectre, he said. The room did not respond. No one knew what the word meant. His name was Command Sergeant Major Victor Wyatt. Retired, recalled, 3 combat tours, theaters without official names. He had worked with the person he was looking for in 2 of them. He had pulled her float registry registration 40 minutes ago from a database that float nurses are not supposed to appear in. He said it again, the same way. Spectre, the room still didn't respond. You could hear the monitor. You could hear the ventilation. You could hear Dr. Calloway breathing through his nose at a volume that suggested he was choosing his next words very carefully. Every person in that trauma bay turned to look around, turned to look at each other, turned to look at the door, turned to look at Wyatt for clarification. Every person except one. I was standing at the edge of the corridor. I had come up from the basement on my own. No one had stopped me, Dennis had been called back upstairs, and the other guard had gone to help with the lobby. I had walked through the East Service entrance and pressed my back against the wall near the isolation cart, just inside the trauma bay entrance, and I had been there for approximately 40 seconds when Wyatt said the word. I looked at my hands, they had stopped shaking. Wyatt scanned the room and found the only person who was not searching for the source of the name. He took one step toward me. He looked directly at me. I looked back. I pushed off the wall. I did not rush. I walked the way I had not walked in 6 years. Not the careful compensated gait of someone managing a knee and managing visibility, but straight. Like something that had been held at an angle for a very long time had finally been allowed to find its vertical. Spectre, Wyatt said, and this time it wasn't a search. It was a confirmation. Yeah, I said. I walked to the patient without looking at anyone else in the room. He was a man in his 30s, military build, field dressings on his left shoulder and his right lateral chest that someone had applied correctly under pressure and that were now soaked through. The monitor showed a blood pressure of 74/48 and dropping. Pulse ox at 84. 5 seconds. I read him in 5 seconds. Tension pneumothorax. Right side. The field dressings had sealed the entry wound and trapped air in the pleural cavity. The lung was collapsing under its own pressure. He had maybe 4 minutes of useful cardiac output left, and that window was already 3 minutes old. I looked at the equipment cart. 14-gauge needle, I said. 5 centimeters. Doctor, Calloway stepped forward. Now wait a minute, move, I said. My voice had changed, not louder. Colder, precise in a way that had nothing to do with anger and everything to do with 1,000 hours of decision-making in conditions that made this trauma bay look like a spa. It did not ask. It told. Calloway stepped back. The tone alone accomplished it. A nurse I did not know handed me the needle. Her hands were shaking. Mine were not. I'm not Spectre anymore, I said, to no one in particular, as I found the landmark, but I know how to do this. Second intercostal space, right side, mid-clavicular line. I found it by feel, 2 finger widths below the clavicle, the resistance of the intercostal musculature giving way to the lighter pressure beneath. I had done this in the back of a moving vehicle outside Kandahar with one hand and a flashlight held in my teeth, guided by a corpsman named Torres, who talked me through the first one and watched in silence for the next 6. I heard his voice now the way I always did when my hands went to work, count to 3 on the advance, wait for the hiss, confirm with aspiration. I slid the needle in. The hiss was immediate, loud enough that 2 people took an audible breath. Air that had been crushing the lung escaped in a controlled rush, and the monitor readings began to shift before I had finished taping the needle in place. Chest tube, I said. 32 French. Someone put it in my hand. Calloway stood at the supply cart with his arms at his sides. The young resident, who had been frozen when the team arrived, had moved to my left and was watching with the focused attention of someone who is learning something they will not forget. I registered them the way I registered the ventilation and the monitor rhythm, peripheral data, not relevant to the calculation in front of me. Wyatt had stopped issuing commands. He had started following mine. I made the incision. 4th intercostal space, anterior axillary line, 3 centimeters, clean. Anatomy does not change based on the quality of the room you are working in. I found the pleural space, advanced the tube, connected to drainage. The monitor climbed. 74 over 48 became 98 over 68. The pulse ox climbed from 84 to 96. The patient's color shifted from the specific gray of a body, making a decision towards something that looked like a future. I stripped my gloves and stepped back. Wyatt looked at the monitor. He looked at me. He said, "She moved the way people move when the stakes are real." Not to me. Not to the room. Just said it, like something he had been carrying that he was now putting down. Wyatt opened the folder. He stood in the center of the trauma bay and did not lower his voice. "For the record," he said, "the woman who just stabilized Sergeant First Class Aaron Mills is Petty Officer First Class Clara Reyes, United States Navy, retired, call sign Spectre. Special Operations Command, 2008 to 2019. 3 deployments to Afghanistan, Helmand Province, Kandahar, Kunar, 2 classified. 31 personnel stabilized under direct fire. 11 extractions from hostile territory. Navy Cross, 2016. The citation is classified, but I'll tell you it involved carrying 2 men out of a structure under active engagement and performing field surgery on one of them while the other provided cover." He closed the folder. "She turned in her badge 40 minutes ago because your board decided she was a liability." He looked at Dr. Calloway. Calloway had no expression that covered what he had just learned. Not shame, exactly. The specific blankness of a person whose organizing framework has been removed, who has not yet found words for what is left. No one spoke. Wyatt turned to face me. He straightened. Behind him, 5 members of his team did the same, one coordinated movement, gear shifting with a sound like something important being settled into place. They saluted. All of them. Simultaneously, clean, correct, held. I thought about Torres, who talked me through my first needle decompression in the dark. I thought about the 11 men I had carried out of places that don't appear on public maps. I thought about 6 years, 23 hospitals, supply corridors, and coffee that tasted like old motor oil. I raised my right hand and returned the salute. The young resident had both hands pressed over her mouth. The nurse who had handed me the needle was looking at the floor. Calloway was placed on administrative leave by end of day. The board retained outside counsel before evening. I accepted this information the way I accept most information, quietly, with both hands visible. Sergeant First Class Aaron Mills was transferred to Walter Reed that evening, stable and sedated, with a .32 French chest tube and a note in his file about the intervention that had kept him alive. I never met him conscious. That was fine. That was the job. I went back downstairs. The supply room in the basement still had a defective latch. I pressed the door at the right angle, and it opened, and I sat for a few minutes on the equipment case, in the same position I had occupied at lunch, eating a different sandwich out of the vending machine that tasted like the plastic wrap it had come in. Then I went back upstairs. There was a veteran in Bay 7, 73 years old, wound on his lower leg, developing the specific smell of something that needed debridement, not more gauze. His chart still had my flag on it. No one had followed up. I found a clean dressing kit in the supply cabinet, and I knocked on the curtain. "Mind if I take a look at that leg?" I said. He studied me for a moment with a particular evaluation of a man who has spent decades reading people quickly and accurately. "You the one they were looking for?" he said. "I'm a nurse," I said. He pulled back the blanket. I sat down and I went to work. Some things, once earned, don't ask permission to come back.